Hello, today I'm talking to Dr. Haroon Gajraj, one of the country's leading vascular surgeons, and we're going to be talking about treatment options for varicose veins. Dr. Gajraj, thank you for answering my questions today. I'd like to start by asking today, when should you see your doctor about varicose veins?
Well, this is difficult because occasionally they are very obvious. You don't need, in many cases, to be medically trained to look at your leg or look at somebody else's leg and see that there's a problem with the veins. Usually there are bulging veins on the surface, usually there are unsightly thread veins, so you know that there's something wrong with the veins. But often there's very little to see actually, and all you have is severe symptoms of ache and discomfort and swelling. So I would suggest you see a specialist if you're concerned about symptoms such as heaviness, aching, throbbing, swelling, particularly at the end of the day, particularly when you've been standing or in hot weather. And I think you should also see a specialist if you have big bulging varicose veins or spider veins. You should also see a specialist if you think you have one of the complications of varicose veins. So for example, if you're developing an itchy patch of skin around your ankle, you might have varicose eczema, which is the warning sign that you're at risk of developing a leg ulcer. And it's important to catch that condition early to prevent a leg ulcer because that's very difficult to treat. You should also see a doctor and have a scan straight away, in my opinion, if you think you've got phlebitis, which is an inflammation of the vein. You get a hard, lumpy, red, tender area, usually as a streak up the leg on the inner side. And I think you should see a doctor if you've got unexplained swelling of your leg, particularly just one leg. If you've recently got off a plane, if you've recently come out of hospital, or if you've been immobile and unwell and in bed at home for any period of time. All of these, I think, should prompt you to go and see your doctor. And your doctor, if he's concerned, should refer you to the hospital for an ultrasound scan.
Is there a cure for varicose veins?
It's very controversial. I don't like the word cure. A cure suggests to me that if you have the treatment, you will never be troubled by varicose veins ever again. I think we're at the stage where if we do a modern treatment, or if we perform a modern treatment based on an ultrasound, we can treat the problem as it is now, and it's very unlikely that the problem in that vein will recur. So in that sense, you might feel it's appropriate to use the word cure if we identify a problem in a specific vein and we treat that vein with one of the modern treatments, such as endo-thermal treatment, a heat-based treatment on the inside of the vein, we can virtually guarantee that vein's not going to cause you any more trouble again. Can I guarantee that you'll never be troubled by varicose veins ever again? I don't think so, because veins that are healthy at the time of treatment may become unhealthy and deteriorate in the future and might be the cause of varicose veins developing in the long term. So I don't like the word cure, I prefer the term recurrence rate. We have treatments now that have a very low recurrence rate compared with some of the old treatments, and that means the risk of developing varicose veins and trouble in the future is extremely low. I think an analogy would be claiming to be able to cure arthritis with a knee joint replacement. Clearly, when you've done a knee joint replacement, you're not going to get arthritis again in that knee, but you might develop arthritis in the other knee, or you might develop arthritis in your ankle or your hip. So you can't cure arthritis with surgery, but you can certainly give long-lasting relief in a particular joint. And in the same way, I think by targeting the treatment appropriately and using modern thermal treatments, such as laser, we can cure, in inverted commas, the problem that you have now, but we can't guarantee you won't develop a similar problem in other veins in your leg or even your other leg.
Should you wait until you've finished having children before having your varicose veins treated?
Well, that is something that was advised quite frequently until recently, and in fact, non-specialists, I think, continue to offer that advice. Don't have your veins treated until you've had all your children and completed your family. I think that's wrong. Women who are at risk of developing problems during their pregnancy already have an underlying vein problem. So the sooner you treat vein problems, the better the outcome and the less risk of deterioration. So my advice would be not to delay until you've completed your family. And I've treated several people who, before they've got pregnant, and that's prevented problems during pregnancy. They haven't developed recurrent veins during their pregnancy. So I think that advice is wrong and should be abandoned.
Does the NHS treat varicose veins?
Well, the NHS does treat varicose veins, but over the last 15 years, there's been a striking reduction in the number of people being treated by the NHS. The criteria for varicose vein treatment have been getting much stricter with time. So I think it's about a 50% reduction over the last 15 years in the numbers of varicose vein procedures being performed. The NHS tends to treat vein problems at the end stage. That is when you've had a complication or you've had a major problem. So a lot of people, for example, with leg ulcers will get treatment for their vein problem. But I'm seeing increasingly people who've had phlebitis who can't get treatment on the NHS, people who have varicose eczema who can't get treatment on the NHS. And certainly if only your problem is aching and throbbing, it's very difficult to get treatment on the NHS now.
Which is the best treatment for varicose veins?
That's a difficult question because we now have lots of different treatments that have replaced surgical stripping. I would certainly put surgical stripping in the category not to be done. We have endo-thermal treatments, which are probably the best if you're suitable or if your vein is suitable for them. They have the lowest risk of that vein ever causing you a problem again. And treatments such as laser and radiofrequency are the best treatment. Having said that, your vein may not be suitable for that treatment. And so, although we have a treatment which is technically the best, your vein or your leg might not be suitable for that treatment, and we may have to modify that and treat you by perhaps ultrasound guided foam sclerotherapy, particularly if your veins have recurred after surgical stripping. We now also have treatments which don't involve heat energy. We now have superglue, which is a so-called non-thermal treatment. It doesn't involve heat energy. It's only been available for 2 or 3 years, and the results are still at an early stage, but the evidence so far is that it's just as effective as laser or radiofrequency. And because it doesn't use heat energy, it doesn't require a large number of local anaesthetic injections or the use of a medical stocking afterwards. So for some people, it might offer a number of advantages. So in answer to your question, what is the best treatment? It depends really on what sort of vein problem you have, the type of vein, and whether you would prefer a thermal treatment or superglue.
Are modern varicose vein treatments painful?
Modern varicose vein treatments have been designed to be performed under local anaesthetic. Apart from the discomfort or slight stinging associated with the local anaesthetic injections themselves, the treatments are not painful.
Is vein stripping a safe and effective treatment for varicose veins?
Vein stripping should really be consigned to history. It was invented over 100 years ago, and it was performed for nearly 100 years without any modification. We now have much better treatments that can be performed under local anaesthetic and can be performed under the guidance of ultrasound. They're much safer. Local anaesthetic puts no strain on the heart or the breathing, so it's much safer from that point of view. We have treatments that are guided by ultrasound that can be performed through little pinpricks, so there's no major incisions and no major scarring, which reduces the risk of infection to virtually zero. And because it's done under local anaesthetic on a walk-in, walk-out basis, the risks of deep vein thrombosis are virtually zero. So the modern treatments are much safer, and I think surgical stripping should now be regarded as historical interest and unsafe in modern terms, yes. Not only are modern treatments safer, they're actually much more effective, because the problem with surgical stripping that's been identified in the last 10 years is that when you cut and tie a vein and remove the middle portion by stripping, the raw ends of the vein, which are still alive, want to regrow and rejoin. And doctors give that a fancy term. We call that neovascularization. But it's that regrowth and rejoining of veins that's the major cause of recurrence, the veins coming back. Now, modern treatments such as laser, which use heat energy inside the vein, they cauterize and sterilize the vein from the inside, and there are no raw ends which are still alive that want to regrow and rejoin. So these modern treatments, which are safer, are also more effective because they don't stimulate this process of neovascularization. So for those two reasons, really, stripping is only of historical interest and should now not be performed.